Okay, so which of the following is the most likely diagnosis? And it looks like we're dealing with GI. So a 70-year-old woman with a history of hypertension and AFib presents to the emergency department with sudden onset of severe left lower quadrant abdominal pain. So I'm thinking 70-year-old man and left lower, so something with maybe sigmoid, diverticulitis, but we'll keep going. Reveal a blood pressure of 165 over 95, heart rate of 110, temperature of 100. Physical examination shows tenderness over the left lower quadrant with no rebound or guarding, and then there's high white blood cells. So there is diverticulitis, but acute appendicitis, there's no rebound tenderness, and usually that's on the right side. Colonic ischemia, it definitely just has more symptoms of diverticulitis. Colonic ischemia, I don't think so. Sigmoid volvulus, that is on the lower left side. Okay, could be. And then inflammatory bowel disease, that usually happens in women, like kind of in their 30s, and you don't see like diarrhea or anything like that, so or constipation. So I don't think it's that. So now I'm diverticulitis or sigmoid volvulus. I know that sigmoid volvulus happens in older people. And the fact that it's sudden, severe left lower quadrant pain, because what is volvulus? Volvulus is where like the sigmoid starts to kind of turn. But the fact that there's the white blood cell count, I'm thinking itis, so diverticulitis.
Okay, final answer.
Yes.
Okay, let's talk about this question here. So I think that's pretty, you're working through it, right? Elevated blood pressure, tachycardia, fever. You're thinking more of an infectious nature in a sense, right? Um, so I think diverticulitis, dealing with the old man's age, right? Things like that, that's going to be consistent with diverticulitis. It just fits the best here. Okay.
Hmm.
Acute appendicitis, right? That's usually on, the patient's right side, right? Colonic ischemia, right? You're probably going to have peritonitic syndrome, right? They're going to be a lot more sick than kind of what you're seeing here. Sigmoid volvulus, can be a answer choice, but not as common as diverticulitis. I'd say, and inflammatory bowel disease, patients a little bit too old to be the first, symptom of inflammatory bowel disease, right? So